Hello, I am Dr. Ami Shah, the test developer and researcher that has authored the comprehensive assessment of accentedness and intelligibility. In this short video, I will be talking to you about this test as it meets all these important scientific and clinical benchmarks. And the purpose of this presentation is so that if you have already bought the test, you can share these important features with your clients as well as your students, not only for educational purposes about what is important in a test, but also so that with your clients, you can be confident that you are providing a standardized, leading, cutting edge work to them, and they can see all the benefits that they're getting by using this test. So this video is very short, and it will be followed by another video where I will be comparing these features with other tests in the market. So let's get right to it. So the CAAI is a comprehensive assessment tool. It looks at 22 areas of communication, does not leave out anything that is relevant to accents. It looks at speech aspects, segmentals, consonant, vowels, and prosody at all levels, words, sentences, syllables. And it also looks at nonverbal communication and pragmatics, as well as auditory comprehension. Again, as I said, it leaves nothing out, so it casts a wide net, and you can identify exactly where the client is struggling with their intelligibility, the clarity, the fluency, and just overall accent. Um, every aspect of this test is quantitative uh, and objective because to be sure, when you work with diversity, linguistic diversity, and cultural diversity, it is very easy to make a subjective decision and get into bias. So, to prevent that, we have made every test, every aspect of this test, every process be very scores driven and quantitative, that is very easy for even students to apply and implement. So, for example, the screening process about who needs accent management is done by the sections 1 and 2 in the test. The entire diagnostic process is scores based. We have also before and after scores to look at progress at periodic junctures. And then we also use scores to decide if the client has met all the goals and is ready for discharge. So again, it's quantitative, which then leads to very outcomes-based results that are not decided by just the clinician's judgment. But rather the scores decide. And it's not just the test scores, but I have a process where I train individuals, clinicians, to compare the test scores with other relevant benchmarks to the client. For example, customer satisfaction scores, patient satisfaction scores, if they're medical professionals that are going through accent management. So the whole process is very outcomes based. I teach this kind of training in through my videos and other presentations. The test is very prescriptive because of this whole approach, which means we can then take these scores in different sections, and it helps set the priority of which goals need to be taken into intervention and in what order. So it lays out the plan with an individual diagnostic profile. And again, I have case studies, published work, and presentations that help clinicians know how to be prescriptive themselves pretty easily. The test is prognostic, which means these scores then and the patterns you see in the scores help you see how long this client is going to need to be in therapy to know how much they will likely have to pay out of pocket or how much their company will have to pay. So it's very important to know the prognosis with scores so that it meets the needs for the administration or the clinician, the clients to know what are they getting into, and how long is this process going to be. Um, all of these decisions are always compared with the local norms. So we actually have, this is the only test where, for accents, that is, where local norms have been sampled, and then you'll see that these local norms, the baseline is provided in the diagnostic profile. And anytime we put the client's scores, they are compared, for every section, they're compared with the norms, what the local norms are, and they're both for native speakers of English as well as non-native speakers of English. So compared to those, where does our client rate and measure, and that will then help decide every aspect of the decision: screening, progress, diagnostics, and discharge. Um, the whole process is tested for reliability, sensitivity, and specificity. Again, this is the only test that is actually um, has attempted reliability testing and is approved by peer-reviewed standards and published. So the testing is both for retest reliability as well as tester reliability, and also sensitivity, as in how sensitive is this test to pick up on accent-related communication issues and not anything else, and also how specific is it, that's to rule out interfering issues that we won't be working on for accent management. So this test has strong scores for all of these measures, and you are welcome to read those papers that will be on our website, caiassessment.com. Um, this test is the only one that is built upon an evidence-based framework. This assessment framework, was developed with ASHA Professional Development Office. It was a webinar, and that is the only framework that is in our field. So I am continuing to present and teach clinicians through various CEU workshops, and the future videos that are going to be posted online, so you can know that that there is a proper standard diagnostic framework that the test is designed on. The test helps you be culturally responsive because of these various features, and the underlying philosophical decision making. And you'll see that is again mentioned in the test manual, in the papers and the case studies that I've published, as well as the presentations that I give at ASHA, as well as places like speechpathology.com, where I currently have some presentations and some new webinars that are coming up. Um, the test has met, over the 20 plus years that the test has been used and bought by clinicians around the country and abroad, including students. The test has found strong clinical endorsements. Many universities hundreds of universities have picked the test as its test of choice, and they follow the whole CAAI protocol. So we have strong endorsements from clinicians as well as clients in a variety of different arenas. They feel very confident, very secure, and they're very happy with the results they got because of this whole approach that is enabled by using this kind of test. Finally, we have proven results, lots of outcomes-based data, testimonials, qualitative statements, and videos from the clients that I have worked with in the medical field, medical communication, that have provided these strong results that speak to their progress in the speech goals, as well as what their patients assess them, the improvements that they made, as well as the supervisors, how they assess them. So these are all the benchmarks that this test proudly meets, and you can be very sure that if you're using this test, you are on the cutting edge, on the right side of things. And if you have not bought the test, then now is your chance to buy it. Please visit the website, and if you have any questions at all, certainly reach out to us. Thank you, and now you can proceed to the next video where I will be comparing the existing test in our field to see where what you are using and whether it is the right thing to use. Thank you for viewing this video.